I've heard of companies having a leaderboard, and every month they say who sent the most Slack messages, and I find it completely ridiculous.
Well, hey, Jonas, welcome to the show. How are you?
Thanks for having me, Rafi. Good to be here. I'm doing really well, thanks. How about
Awesome.
yourself?
Oh, I'm doing great. Well, not as good as someone that just was on vacation for a while, but I'm going on vacation in a little bit. So I'm excited about diving into this whole world of like healthcare tech and startups and kind of growing these businesses. But before we get too far into the weeds, tell me a little bit about yourself, kind of your background, and how you got to what you're doing now.
Yeah, sure. My name's Jonas Das. I'm currently advising on go-to-market in medtech and life sciences. My core area of expertise there is software as a medical device, oftentimes abbreviated as SAMD. I help companies set up shop in the US and sometimes other markets. So I help them hire the right people at the right time, help them understand or find their customer and their economic buyer, or I help them secure investments or partnerships. Sometimes help them, plan an exit, an acquisition. Formerly, before that, I've been doing that for about 1.5 years. Before that, I was the US CEO of Kaya Health, a company that delivers holistic tech-enabled therapies for chronic conditions via tablet and smartphone. And Kaya's two therapeutic areas are chronic pain, which falls under the musculoskeletal
Yeah.
MSK cost bucket, and COPD, which is a lung condition and the third leading cause of death worldwide after heart conditions and cancer. Yeah, I was at Kaya about 5 years. My background is in engineering originally, but I was, as mentioned, much more focused on business development, the commercial
Yeah.
side of things. But still, kind of my mind is still quite technical when problem solving. I tend to be sometimes tend to be a little bit in my head,
Yeah.
but try to actively work against that sometimes. Yeah, my background is in engineering. As mentioned, I'm married. We have two cats,
Okay.
Goose and Andy. Love traveling and adventure sports. Went to Japan and Vietnam last year. Did a motorcycle tour
Nice.
close to the Chinese border in the remote north of the country. And on the sports side, I really love mountain biking in my home country, Switzerland. Skiing whenever I can make the trip, either to Switzerland or Colorado. And maybe the last one, I do really love languages and other cultures. I spent some time in New Zealand during high school. That's where I learned English originally. Came back with a thick Kiwi accent,
Yeah.
which by now I've lost. It's kind of all over the place now. And also spent a year in Spain, where I really immersed myself in the Spanish culture and language, which still I almost feel like I'm Spanish at heart to this
Yeah.
day. I really enjoy going back and meeting my friends there and enjoying the food and the culture.
That's awesome. So, I guess before we dive into even health tech, like, did you go into engineering as a career path in a field thinking you were going to work in the startup world, or how did that manifest? Because I'm always interested in hearing like the path that people took, and from engineer to like CEO of this big healthcare technology company is a pretty interesting ride.
Yeah, um, yeah, it certainly wasn't a straight one. I I was always a very curious person growing up, and it was kind of hard for me to crystallize out which subject I wanted to, focus on in high school and then later major in. And yeah, at the time, it seems so stupid now, but at the time, kind of math and physics wasn't my strongest suit, and I wanted to challenge myself, and I was very interested though in technology, and so that was part of the thinking process why I figured, okay, I'm just going to start. studying mechanical engineering, and the school where I went, ETH Zurich, also allowed you to switch within the first 3 weeks if you wanted to. But I just got so immersed in it that never thought about anything anymore, and just went straight ahead and I got the degree, and only later, I think in my master's, my goal was to in my master's I did process engineering, and my goal became to um, potentially build and plan and design the plants in pharmaceutical industry, the actual drug
Yeah.
um, drug cooking plants. And once I started working with the software that you would use to do that, I realized I do not want to do that for the rest of my
Yeah.
life. I do not see myself doing that. And that's kind of at the same time I always did, dream about being an inventor, maybe starting a company one day. And then yeah, kind of one thing came together with another, and together with my friend David, this idea around COPD came about that we're going to talk about more.
Yeah. So I guess then you kind of give us the kind of what Kaya Health does, but give us the 30,000 overview of kind of the story of Kaya Health and how that evolved as you kind of stepped into that leadership role, and then we'll kind of dive into the weeds a little bit about actually running a healthcare tech startup and burnout and all of that.
Yeah, sure. And I want to say, as I said, I'm not a Kaya anymore, and so I'm not representing Kaya
Oh
here. I'm
yeah, yeah.
just talking about my trajectory and my views. Um, yeah, so I guess towards the end of my degree, my friend David Boutelier came to the rescue, so to say. He had studied business. We met when we did an internship in the Swiss consulate in Boston. It's called Swiss Next. It's a consulate that is very focused on connecting Swiss startups with the Northern American environment, and the other way around, and
Yeah.
the same for universities. And so that's where we had met, and we realized, me coming from a technical school and him coming from a business school, we would, and us just being friends, we would potentially be a good co-founder pair. And and so he was working on this idea at university. It was like a group project where a pharmaceutical company was looking for a solution that would get COPD patients to exercise more, because COPD is a condition that is not curable, but you can train your cardiopulmonary system, and you
Yeah.
can, do certain education. I don't have to explain it to you as an occupational therapist. Um, you can do certain things to improve health-related quality of life, and physical capacity, physical activity, more social interactions. And at that point, there was an existing intervention called pulmonary rehabilitation, and basically, accelerated version of what happened was we started talking with pulmonologists in the field and realized this therapy has a very broad body of evidence, but it has an access problem. Only the sickest patients get access to these clinics. They go there, when basically they're on their last.
Yeah, there are no
They're
other
almost on their
options
last
basically.
leg, right?
Yeah.
There are not many other options, and actually COPD could be diagnosed much earlier, and those people would benefit from that therapy as well. But it's too expensive oftentimes to make it available that broadly, because it is, again, the third leading cause of death. Lots of people get COPD at some point in their life. So yeah, we started digitizing that treatment, and basically wrapped a technology layer around it, wrapped a human layer, a health coaching and layer around it, and then ran clinical trials to establish that our delivery and our components of that therapy were also clinically valid and had comparable outcomes or beneficial outcomes. And and yeah, that's when we met Constantine Mail and Manuel Turner, the who founded Kaya in 2016, sorry. And we realized they had been working on something similar in the chronic pain space, and they had solved some of the, technical infrastructure problems, regulatory work, and David and I had built clinical partnerships, concept. We're on the way to licensing evidence-based content. And so that helped us to kind of, we started
Yeah.
talking, and in the room was joint venture, investment, joining. So we went to Munich, sat with the team at that time, and realized, there was good chemistry, and we could really benefit from what they had built to this day, and we could basically bring in a second product line into Kaya at a very early stage. So we did something that is quite unconventional at these early stages, and we joined Kaya. That's also why we got co-founder titles, because we brought that product in, and then took on roles inside Kaya, which in the beginning we were very focused on getting that COPD product off the ground. Um, it's kind of crazy. Uh, Stefan Huber, the chief medical officer at the time, he once told me this figure. 2 months after officially joining, we had a CE marked medical device on the market thanks to this symbiosis. So that really talks to how much, how well that symbiosis had worked.
Yeah.
Yeah, and then, it was focused on evidence generation strategies in the beginning. Pharma became quite interested in the COPD product, but also in the chronic pain product. So my role started becoming more of a strategic partnerships role for a while. And then already during that same year, 2018, it became clear that we wanted to establish a bigger presence in the US. And so in fall 18, I started flying back and forth, um, started establishing the office there, started hiring the first people in March 19, and then kind of had to wrap up some of the work I was doing in Europe still with that pharma partnership, and at the same time then fully focus on the US and move over here, focusing on building a commercial team and operations team.
Yeah. So at the time, you were operating exclusively, or not exclusively, but you weren't operating in the US. You were kind of growing that in the US.
Yeah.
Tell me a little bit about, and I get this a lot from companies that are wanting to come into the US. Maybe they've operated in Europe for a while, or maybe they're in Canada or something like that. There are some big differences between health tech companies outside the U.S. and inside the U.S. and kind of merging those, like the business models and who pays for it and how does it, like how does healthcare in general work, like is a big thing to kind of work through, right? As you're bringing that company over or of scaling up operations here, right?
Yeah, I mean, as you can hear, I'm not American. I'm Swiss. So again, I think probably my extreme curiosity and some of the perseverance that I had from my engineering degree helped to dive in and try and understand all the stakeholders and the systems in place in US healthcare. Um, so yeah, it was quite a lot to digest, and at the same time, we tried to be laser focused and build towards a somewhat proven business model with
Yeah.
self-insured employers and payers, while also looking at the other stakeholders in the ecosystem and potential strategic
Yeah.
partnerships.
Well, and I'd imagine like self-employed or self-insured employers and all that, they were just the low-hanging fruit, right? Like they had the incentive is there for them to make improvements in those populations, and then they have the funds to do it, and you're not dealing with some of the like third-party payers. How does that all work? Like the insurance companies, right?
Totally. And I mean, at the time also, this was now 6 years ago. So at the time, it was also much more of a greenfield market opportunity. I still have clients today that sometimes ask me, should we take that path? And I usually advise against it
Yeah.
because you can only really make a business out of it if you address the top 3 to 5 cost categories of these employers. And yes, they may vary slightly depending on industry and from employer to employer. But these top three cost categories, they're very crowded now, and
Yeah.
there's big incumbents now. At the time, musculoskeletal was one of them, and there are recently I've seen companies that take a slightly different approach. So one company that I've recently um, interacted with was more on they basically said autoimmune conditions, conditions that are oftentimes, have expensive prescriptions like biologics, Humira, and the
Yeah.
kind, which are a huge cost factor for employers.
But
You
a
could
much
actually
smaller
categorize
population.
them
Yeah.
together as well, and you also end up in a top 3 or 5 cost category, and that's maybe a field that is still a little bit more open than some of the other traditional cost categories, the way the employer gets it on the financial statement from their health plan.
Yeah. Yeah. It's that whole adage. Someone once told me a while back, like, there's a fine line when you're looking at where like segments of an industry to go into. Like settlers make a good living, but pioneers get arrows in their back. But there's that fine line where if there's too many settlers in an area, then it's hard to eke out a living, right? Because you have incumbents that are there that are they just have the market. It's hard to compete with them when they're established. Um, I do want to pivot a little bit. You referenced on LinkedIn a while back, because we haven't talked in a while, about a time you got close to burnout when you were running a health tech startup. I'm assuming this whole segment of your career with Kaya and scaling up here. What do you think were some of the factors that led to the feelings of burnout? And then maybe we'll kind of dive into how you worked through it and some of the insights you gained as a result.
Yeah, yeah, it was kind of a, I don't want to say a random LinkedIn post, but I just something inspired me to write about it, and because I think burnout isn't black or white, and it's also an extremely overused term,
Yeah.
and a lot of people have a wrong idea about it, and also I think a lot of people are afraid to talk about it because they think they might be perceived as a weakling, or um, it might mean that this will happen again, and I think actually it's quite the opposite is true. I think it shows personal strength to be able to talk about this topic, and 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 also I think it actually, when you went through it once, it might actually make you stronger. It depends, right? If you had the kind of burnout where you can hardly get up, or where you literally cannot get up in the morning anymore, yeah, you might as well have kind of lifelong limitations based on
Yeah.
that. Thankfully for me, it was July 2020, midst of the pandemic. I lived in New York. New York was the epicenter of the
Yeah.
pandemic, if you remember, after Italy. Um, and we were a young company, small team. Most of the people came into the office every day. So we had to kind of move the people from the in-office setting to the remote setting. Unfortunately, had to let some people go at the same time, um, and so there were just a lot of things coming together. You live in this small apartment in New York. You can hardly go outside sometimes. The restrictions were really very extreme, and then yeah, there was just so much to do. There's startup environment in general, long hours, always fires to extinguish, problems to solve, they never end, and then this
Yeah.
whole COVID situation on top. And yeah, I think I randomly came across a questionnaire on the internet on what the symptoms of burnout actually are. and I realized they were not at all just what I thought they were. The fatigue aspect, the drained aspect, the not being able to get out of bed. Yes, that's one aspect, but I was less aware of the kind of the emotional components. And so I just for fun, so to say, I filled out the quick questionnaire and I realized, oh shit, I have early signs of what is called burnout. And I wouldn't have realized. And that was the crazy thing. I don't think I realized it at all. And then thinking about it and reflecting on it later, I realized, oh yeah, it's true. You know, I would come home after work and my it was just literally 2 blocks walking during COVID, not even, from the office to my place. And I would pretty quickly open the laptop again, work again till 10, 11, 12 p.m. Then obviously my relationship would, suffer from that. Um, then all of that would again impact your sleep. And then when you have less sleep, that impacts your energy
Everything.
level. You
Yeah.
get less done. When you get less done, things pile up. You force yourself even more. And so it's that cycle that starts very slowly, and you don't realize at all. And because of this aspect of you losing that top view, that 10,000-foot view about yourself and not having that clarity and energy anymore, I think that's why it's so tricky. And I think that's why some people end up just waking up one morning and not being able to move anymore because they just don't realize for so long. So yeah, what I did was take a vacation as soon as possible, 2 weeks, not just one. And um, yeah, I went to Puerto Rico with my girlfriend at the time and really tried to unplug. I did have to do one meeting for a new partnership with a big payer that I needed to do, and at the same and so that was the only meeting that I was going to do. And then second day I was on the vacation, I got this text from a partner of a different deal that I had to wrap up, saying, "Hey, we gotta close this out in the next 2 weeks." So we had been negotiating that agreement for 10, 11 months, and
Oh wow.
he was saying, "We got to close this out. We're running against the hard deadline." Thankfully, the lawyer was in Europe, um, and so I just had to end up, working on that agreement again every morning or every other morning during the vacation, um, which was fine. It just, yeah, defeated the purpose a little bit. And yeah, anyways, long way of saying, yeah, I think people need to be more aware, acutely aware of their energy levels. And I think also what I learned afterwards was thankfully I caught it in time, but it takes a long time to really get back to the energy level that where you were at before. And I'm really happy that I am back. And I mean, I already got to a much better energy level while I was still at Kaya, but now not being at Kaya and having some more flexibility for a while has helped tremendously as well. And now I just feel like my old self and really back and ready to move mountains.
Yeah. Yeah. Well, and I think one of the things you said really kind of echoes like especially in startup worlds. I talk to people all the time. They're like, "Well, it's supposed to be long hours. We're supposed to be burning the midnight oil. We've got all these deadlines. There's more work than you can ever do." And then on top of that, especially in the tech space, it's not like you have to turn work off, right? Like you said, you would get home and open the laptop, and you've got another 4 hours of work you can do, right? And I think that's one of the big challenges in that, like when it comes to burnout too. Like if it's always there, and it's very easy to answer one more email or send one more text, or go in if you're on the tech side, do a little bit more coding or whatever it is. There's always like that constant pull, right, to work and to get more done.
Yeah, this whole Slack culture is very bad, in my opinion. Having Slack on your phone,
Oh yeah.
in my view, over time, for most employees, um, it actually diminishes your productivity. and it
Yeah.
sets the wrong example. I've heard of companies having a leaderboard, and every month they say who sent the most Slack messages, and I find it completely ridiculous,
Yeah.
because that is such a stupid, fake proxy of productivity. I think
Yeah.
it's quite the opposite, actually. And
Yeah, you're
um,
confusing activity with
yeah,
accomplishment.
and it's not even helpful activity, you know? Oftentimes, you shouldn't write messages. You should just quickly hop on a call and square something away. And when the way I handled the thing about availability usually was people I worked with closely, they had my WhatsApp or my iMessage.
Uh-huh.
And I told them, look, things that are non-important long form or non-urgent long form, they go in email. Things that are urgent but not crazy urgent, you can write me on Slack, but don't expect me to write back in 5 minutes. And so I would go on Slack, I don't know, 2, 3 times a day and try and work it away. And then things that required a discussion, I would usually try and call the person, right? Of course, as an IC, you cannot always do that because your boss might be in a meeting. Um, and then the the WhatsApp piece would just be, look, you have my phone number. If there is something where you do need to reach me, um, you're going to be smart enough to know whether whether it's worth um,
Yeah.
making the phone call or sending the text now or not, and then I will respond and I will be there. And then I think it works much better rather than turning on all notifications of all channels in Slack, and then you're just always on and nothing gets done anymore because everybody's just chatting.
Yeah. Yeah, and there's that, I know it gets referenced a lot, but like when it comes to like performance theory and like the psychology of performance and all that, there's all that attention span, and like every time you have an interruption in deep productive work, it takes you 20 minutes to get back on
Yeah,
track. Like a two-line Slack message could actually cause 15 minutes of just wasted time. Which
yeah.
is
I've
not
also
cool.
changed my opinion on these random channels.
Uh-huh.
There's the traditional random channel, which I think you should just delete out, deactivate. And then there's all these, book clubs and
Yeah.
this at company and that at company, and we're in this company because we want to work together and we want to, grow revenue, become profitable, um, put a great product out there, and we have to survive. And survive, I mean, I think we're going to talk about that later maybe, but survival is not a given at all.
Yeah.
And we don't have time and capacity for all these other things. I think it's fine that people, talk about their hobbies and meet each other outside of work and so on, but I don't think it's something that should happen on Slack and always during work hours. I think it it distracts from the actual mission.
Yeah. Which is kind of going back to that the mission and you're working as a team. I know you've talked about it before and you've mentioned like professional athletes and the parallels between being a professional athlete on like a performance team and high performance startup. In our case, we're going to talk about health tech startups, but I'm sure it crosses the like any startup that you're doing. Explain that a little bit, kind of that the parallels you see between high performance athletes and what it takes to build really a high performance startup team in the tech world.
Yeah. Um, so let me start with my family and then why this has caught my attention recently a bit more. So I have 30 cousins, um,
Nice.
about 15 on my mom's and about 15 on my dad's side, more or less, and grew up with all of them pretty close by, which is at the time I thought it was normal, but apparently it's
Yeah,
not
it's
normal.
not normal. Yeah, that's awesome.
And and so yeah, I know you have a lot of kids, so I thought you'd appreciate this
Yes.
maybe.
Yeah, yeah,
And and so some of those cousins they really also felt like brothers and sisters to me, and to this day we're very close. And Um, Now, on my mom's side specifically, several of them are or were world-class athletes in cross-country skiing, ice hockey, track cycling, ski jump, Nordic combination. And while I had good endurance and I loved mountain biking, and I was never particularly interested in becoming a professional athlete. Maybe, maybe mainly because I had an extreme like intellectual curiosity and thirst for knowledge, so that I used up all my time reading and clicking through the depths of Wikipedia links rather than wanting to train and compete on the bike. Maybe it was because my mom was always would have wanted to become a professional athlete, but it wasn't possible for her. Or maybe she tried to materialize that in me, and subconsciously I realized it and was stubborn enough to not want to. I don't know. But I did learn and see up close what it, what was the incredible dedication that is required. Um, and it's discipline, not only discipline in your exercise routine and schedule, but also nutrition, not going out, not drinking any alcohol, sleeping enough, etc., etc. And obviously, even then you could barely make it to the World Cup level competitions and World Championships and
Yeah.
compete at the very, very top, even if you got all of that right. Um, and so there's obviously that psychological element. And more recently, I watched documentaries about great athletes, such as the women's and men's 100 and 200 meter sprinters. There's a documentary on Netflix there, and also about Simone Biles in her preparation for the Olympics, and also big topic was her mental health and how it
Yeah.
impacted, how she had to retract from the Olympics in Japan, and how she worked her way back from that, and how also the role that social media played and the public opinion of her, people having an opinion of her without ever even having
Knowing her. Yeah.
listened to an
Exactly.
interview or knowing her or knowing her environment, and just kind of having these really crazy opinions and saying these terrible things on social media. Um, and so I was deeply impressed by the mindset that these athletes are in, really pushing reality almost to a degree where you would deem it unhealthy in other situations. This is particularly true for the 100-meter runners.
Uh huh.
They really believe, it's 10 seconds, right? Or not even that matter. And so they believe that this moment, this world, this stadium full of people is there for them. They are the center of the world. That moment, what they perceive is is there for them. It's made for them. They are not some random human on a rock in the Milky Way, uh, you know, unimportant stardust. No, no, they are the very reason for the existence
Uh huh.
of their perception. And while I think in the business world, maybe humility is important sometimes. But I think this is a great insight where you see at the extremes how confident and sure of yourself you have to be to first visualize and then materialize your success. And while I don't think it's healthy, I don't think it would be healthy to be a complete narcissist and completely self-centered every day, all day long. As an entrepreneur, I do believe that you need this visualization and materialization, because it's not a rational choice to start a business. By that I mean a high growth VC backed company,
Yeah.
call it a startup, because the odds are stacked against you. So you need some irrational portion of optimism that you will win. Um, and otherwise, every setback will crush you, and you won't stand a chance.
Yeah. Because well, I mean, if you were looking at it just on the numbers, right? Like how many VC backed companies actually make it to the success level that their startups kind of would hope for. I mean, sure, you've got some that eke out in earnings, maybe they get acquired. You've got the vast majority of them though, and you mentioned this earlier, like survival is not not always a guarantee for sure, and sometimes it's like the odds are not in your favor, right?
Yeah, it's just the way this game works, right? VCs are looking for outsized returns in one company. One out of 100 returns the whole fund. It's a probabilistic game. So by design, if you're one of those 100, the statistics are against you. So you better be damn sure that you're the one out of the 100. Um, and that's why you have to be somewhat irrational, and that's why I think these visualization techniques and this psychology of really believing in yourself and seeing yourself successful is extremely important. And then there's another important, not important, but there's another interesting parallel, which is, I can't remember who it was, but he was doing a podcast with Tim Ferriss, and maybe he was also on the Knowledge podcast recently with Shane Parrish. And he was this mental coach who worked with a lot of professional athletes. And one of his techniques was to say, we all have alter egos, or we all have parts that are, sub parts of our personality. And we need to be willing to step into those and harness the energy and the pros that they come with in the right moment. They also have cons, so you want to avoid the wrong one as well in the wrong moment. And the example that he had was, there was this tennis player. She was fantastic, World Cup level, and sometimes she would just lose important points. And she was this extremely charismatic, friendly, great player. Um, and they were able to point it down, and a very fair sportswoman as well. And yeah, they realized that sometimes subconsciously she was giving points away. Um, and you cannot do that in tennis. Roger Federer recently said, right? He he only won, I think he won 80% of all matches he played, but he only won like 52% of the points or something like that. So you really got to make those points that matter.
Yeah.
Um, and so they started building up this alter ego of hers. They gave her a different name, and she was not nice, and she was not, she was all about the game
Yeah.
and fierce, and she wouldn't gift any points. Quite the opposite. She would take points. And they just worked on building out that personality and that part, and her being able to seamlessly step into and out of that part, and it really transformed her career. And so I think the same goes for entrepreneurship, and I think any aspect in life. All too often people talk about, you put a mask on at work or this or that, and kind of negatively connotated. And I don't think of it that way. I think there's something positive if you can do that, and you can sort of also protect yourself by then going back when you're with your family and your friends, that you can step into that zone where you're the family person and the friend, and you don't need to come and rationally problem solve stuff in your relationship, but you can be more empathetic and maybe a more active listener, um, things like that.
Yeah.
And before, and one last point,
Yeah.
it's actually also a therapy approach. So it's called interfamily systems.
Yes. Yeah. Yeah.
You heard of it?
I have. Yeah.
So, or some therapists call it parts work, where you kind of try and have a conversation with these subparts. You try and identify them, especially when you work through problems, maybe with your therapist. You can also do it on your own. You can journal with those parts and kind of just see what comes up, and the goal is integrating them more into an overarching self, right? And I find that really interesting because it doesn't mean that you're separating the parts out. It just makes you aware of them. And by being aware of them, you can access them more easily, but they also don't just suddenly come up and disrupt your whole life in the wrong situation.
Yeah. No, I think that's interesting. Preparing for this conversation, I didn't think we were going to take this bend, but it's interesting and it's awesome.
Tell me more about where you know parts work from.
So I did a lot of consulting, independent healthcare consulting for a Department of Behavioral Health and Developmental Disabilities back in the day, and our team was like a hodgepodge. Got brought in to do some project management, policy analytics, and like clinical operations work, but we had psychologists and family counselors, and the whole gamut was part of our core team. So I have not studied it in any depth, but it came up in a few conversations, specifically maybe around a specific case or a specific issue or something like that. One of the psychologists there he was a forensic psychologist, but then he also did some family work. So yeah, it's interesting.
Got it. Really interesting. Yeah.
Yeah. So we've kind of talked about mindset a good bit, but um, besides what we've covered, kind of integrating all of the different parts, and maybe even this idea of performance and turning it off and bringing it, integrating it into your life so that it's not taking over your life, but you can seamlessly step in and step out, and then this awesome confidence that everything's going to go right, even if it might not. Are there any other specific like challenges or barriers that health tech entrepreneurs might face in their path to hopefully growing and scaling and maybe exiting or just turning their business into awesomeness?
Yeah, so many. Healthcare is hard, right?
Yeah,
And it's broken. And there's a lot of opportunity, but also the barriers of entry are really high.
yeah,
The incumbents find ways of kind of, you know, Epic and Cerner is a good example, right? Where the government kind of,
yeah. I was about to say that regulatory impact and all of that is a challenge for sure.
yeah. So the barriers of entry are high. The sales cycles are long. Most companies will run out of money before they can scale to a decent degree, or they never even get there and fail already at the stage of proving their clinical
Yeah,
value. So you have to be ready to run this marathon. So more so than in other industries. It does go back a little bit to what we talked about, energy and confidence. But I do think particularly in if you do it in healthcare, a startup in healthcare, you need it even more just based on the way things are set up, right? Some things just take time. A clinical trial just takes time.
yeah,
They cannot be solved with money. There are certain sales cycles in, during certain times, health plans or employers are shopping, and then
miss that
um,
window.
if you miss that window, then you're going to wait for a year. And so, yeah, some things cannot be solved with money, and the failure of Babylon, for example, and other once deemed unicorns are great examples of that, of how spectacularly you can fail, even if you raise hundreds of millions.
Yeah, yeah. I think that's one of the. I was talking to somebody the other day, and he is a VC. He runs a VC firm, and he was like, just because you have money does not necessarily mean you're going to be successful. In fact, sometimes it just accelerates your demise, right? You get all this capital in, and sometimes that money just covers up issues or deficiencies in the business, which is one issue. But then the other thing is, like, especially in healthcare, as you mentioned, there's time frames and windows for when buyers are actually making deals, and if you miss it, then you're waiting, and you're going through your all of your runway while that's happening, and it's a challenge for sure.
Yeah,
Yeah,
and something I see in my clients oftentimes is they have a solution looking for a problem, or
yeah,
maybe they solve a problem too for the consumer, for the individual, but they don't have an economic buyer. And and yeah, that's the other thing, right? In healthcare, more so than in other industries, um, distribution is paramount. Your commercial model is paramount,
Uh-huh.
and the regulatory environment, how you're restricted by the legal aspects in different geographies. It is extremely important to think well about which market you want to enter and when, um, because otherwise you're betting your whole company if you do that wrong.
Yeah. Um, okay. The last question that I had in my mind for you is like, what do you think are 2 to 3 keys to successfully starting and scaling a healthcare tech startup? I know we've talked about a bunch of them, and timing was one of them, and the mindset. What would be 2 or 3 keys you'd give to a potential founder or co-founder?
Yeah, you just said one. Be in the right place at the right time. You can only influence that so much, but I do think you can be smart about what company you build at a certain
Uh,
time. So I do think we're in an interesting window of opportunity right now with AI. Certainly, part of it is a hype,
yep.
but I also do think a big part of opportunities have come about that were not possible 2 or 3 years ago. Um, yeah, you have to be a realistic optimist and an optimistic realist. We talked a bit about the optimist part of that. I think the realist part is, you have to, yeah, see where you are making mistakes, if possible, or learning from your mistakes. Um, I think you need to be able to set, again, optimistic but realistic goals and track towards them, measure them, and also I think being realistic about things like budget, ROI, um, financial discipline. That's where reality really hits you, right? And every optimism or being visionary and knowing what you want isn't going to help you if you cannot translate this into your P&L.
Yeah. Awesome.
And then one last one,
Sure.
supportive social environment.
Uh huh.
Um, you're going to have to put your everything into this, and so that means other people will have less of you, usually the people you're closest with, and they got to be on board with that. And they have to be able to, you have to have that support because otherwise it's not going to work out.
Yeah. No, that's such a big key too. Someone once told me the key to success was to marry well. I think
Yeah,
there's
it's a
the
big
more
one.
and more I've gotten into this, the more and more I've seen that's probably very true.
One of the biggest decisions in your life for sure.
Yeah. Um, well, Jonas, thanks so much for taking the time. If people want to connect with you, learn more about you and your work, where can they do that?
Yeah, I think best way is LinkedIn. Connect with
Okay.
me on LinkedIn. Send me a message. That's Jonas Duss, JONASDUSS. I think there's only one of me. Um, yeah, just reach out on LinkedIn and shoot me a message.
Cool deal. Well, we'll link to that in the show notes too as well. So, thanks so much, man. Have a good one.
Thank you. Thanks for having me. Great conversation.